come up and they have created a pool of rooms in various hotels across the United States, and their help is being recognized in this regard, and that is a great thing that is happening. The second thing that we had done here, as also the consulates had done, was to reach out to the community, particularly the AAPI members, for a panel of the Indian community doctors who could be there, who could attend to the people who are in need of that. And this, over a period of time, as we have experienced, has expanded into many other things. That is, the Indian students who may probably not have, there may be some problems, or there may be some issues with the health insurance they may have or may not have at this juncture. The visitors from India, the Indian citizens who are there in the United States and who are stranded as of now, their return plans have not been have been successful in terms because of the disruptions in the flights and other things because of the situation. So their need also, and we have also come to know that many of the people who are visiting presently the United States, in some of the cases, their health insurance, I mean, there is a need for them to extend their health insurance. Also, in some cases, the people who had come with some prescription medicines from India and their stock of prescription medicines is exhausting, and they are in urgent need for some kind of help in this regard to help that. So this we are coordinating, but this can be one of the topics for discussion because AAPI is taking a lead in this regard, and I think the AAPI is one of the greatest resources for India, and we are proud of that. So we can handle that. Then we have another category of request which has come, of course, the students relating to their visa status, the F1 visa or J1 visa, or in case where the visitors are here on B1, B2 visa, or there are cases related to H1 B and things like that. So our interlocution with the US side has, we have been advised that the situation is evolving. They are doing all that they can, and they have advised everybody to apply online on USCIS website for the extension or whatever is there, and but they have not yet come out with a clear this thing that how this will be done. But they have asked us to advise people to work in that direction. Now, on the part of to attending to the Indian students in the United States, we have formed a committee which is there in the embassy, as also in all the consulates. We are holding regular meetings, and of course nowadays we have moved on to the virtual mode of meeting. And we have issued today only, we updated the advisory for the students based on the travel restrictions, based on our interlocution with the United States government, that what can be helpful to these students in this hour of crisis, which is there, as also the suspension of international travel to India till 14th of April. So we have issued similarly all the issues or all the advisories or all the instructions that we are getting from India. We are promptly putting that out in public domain, as also sharing with all the community people, so that it can be made available to everybody for them, for the benefit, and they can work accordingly. All of us are cognizant of the fact that it's a very, very difficult situation for everybody. There may not be answers to a lot of things at the current juncture, but Government of India remains committed, and Embassy of India, of course, remains committed to help our people in whatever way we can. We also had a request relating to when the OCI cards, as all of you are aware, OCI has been held in abeyance till 15th of April as of now. But in emergency cases, we had tried to help people getting the visas. But of course, that also becomes is not valid at present juncture because the flights are not there to India as of now. We have also advised everybody, Indian students and others, to factor in all the health related advisories, the travel related advisories which are being issued by the US government from time to time, to be aware of that, to take precautions. And it is difficult to say, but it is important to note that at current juncture, any travel going here or there is fraught with a lot of danger. So everybody is advised to be where they are, stay put for the time being. And in that endeavor, whatever help that we can provide in terms of accommodation, in terms of availability of the food, etc., to them where they are facing problems, or in terms of medical help, that will be a great asset. So embassy and all the consulates remain committed to be there, available to the community at all the times and help them in the maximum possible manner. So Dr. Reddy, this is what I wanted to say right in the beginning, and I think I will wait to hear from others. Thank you.
Thank you so much, Honorable Anurag Kumar Garu. Then let me introduce Dr. Thelma David, if she's here. She has been an extremely resourceful from embassy side, and she's also, I'm proud to say, she's part of our AAPI COVID task force. Dr. David, are you here?
Dr. Reddy, may I just mention that my colleague, Mr. Vinayak Pratap Rao Chauhan, he is First Secretary, Consular Passport Visa. I had requested him to join. Yeah, he is also there. Yeah,
Pratap Chauhan ji, could you please give your input?
Sure. Namaskar to everybody. After Anurag sir has given you the broad outline, if there are any specific queries related to consular matters, OCI, passports, etc., I will be glad to share my views on them and provide as much inputs as possible.
Thank you, Ji. And so I will, at this point, I'll give it to Harish Kolasani if he'd like to introduce anybody else, and then Dr. Lokesh and either I and Dr. Anupama Gotimukula will coordinate, and we have 3 or 4 guest physician speakers. So Harish, it's your time. Go ahead.
Is Harish unmuted?
Harish? Vijay, can you unmute Harish? I don't know if do you need the Harish number to unmute him?
Yeah, I mean, I couldn't find his number. That's what I'm trying to see.
His number is 847-553-8594.
Yeah, unmuted him. Unmuted.
Yeah, I got it. Hello, everyone. This is Harish Kolasani, National President of NCIA. First of all, I want to thank AAPI and Embassy, of course, for giving this opportunity. And I know it's a horrible time right now, so I just want to introduce our chairman, Sunil Singh Ji. He will give the introduction of the organization. Thank you.
Well, Harish, thank you. I just want to thank Dr. Reddy, Suresh Reddy ji, Harish, and Dr. Bharat Barai, our Dr. Jampala, and Dr. Mustala for arranging this. I want to thank to Embassy and all the other doctors from AAPI, who have joined and who have organized this for the community. Thank you, Anurag ji, and somebody else was from Embassy. Thanks both of you for joining. Vinayak ji, sorry. So now go ahead.
Also, Lokesh Hedra ji, Dr. Lokesh Hedra ji is the one who's been really helping us.
Sorry, I forgot.
After Suresh ji, of course.
Yeah. Lokesh ji, thank you.
Thank you, Lokesh ji.
Lokesh, you can take over. Lokesh, you can take over and start the meeting.
Okay. Thank you so much for all everyone joining. I'm going to Dr. I think we have Usha Perumalai, infectious disease. Are you on, madam?
Yes, sir.
Yeah, can you mention a few minutes? She's infectious disease specialist from Pittsburgh about coronavirus. Very few minutes. Then we'll go to Dr.
Sure. Yeah. Thank you so much, AAPI, for giving me this opportunity again. My name is Usha Karamodi. I'm based in Pittsburgh. I work in a private setting here. So as all the listeners. I'm sure you all have been listening, hearing a lot of information on these novel coronaviruses. They wanted me to talk a few minutes on coronaviruses, which have been there. Coronavirus in general have existed for a long, long time, which is common viruses which cause cold. But this new virus, that's the new one which we're seeing, that's why we call it a novel coronavirus, which we're seeing. And the reason we need to be social distancing, and practicing great hygiene is because of how infective it is, how easily it can spread from one person to another. That's one of the reasons, because of the high infectivity nature of the virus, the new virus. That's why we're seeing a tremendous number of cases across the globe at this point, So as we all know, the common symptoms we see are usually fever, sore throat, cough, and if the disease gets worse, you can see difficulty breathing. Earlier you recognize your symptoms, earlier you call your provider to be tested, especially if you're in a hotspot areas. At this point the travel history is irrelevant. So even if you're been in the U.S. and not traveled within the last 3-4 months, I think given the amount of cases we have, you should call your doctor to be evaluated and see if you fit the criteria for testing at this point. Again, obviously, older individuals, they are everybody at any age other than children, even age group of 40 to 50 years and 55 to 65 and above 65, they are at high risk of acquiring the disease. And the more medical problems you have, the higher chance of, getting more sicker at this point, so.
Okay.
So that's the new thing, and I mean, as much as everywhere we hear on the news, we see social distancing and hand hygiene, all the precautionary measures we need to take is going to help us prevent us from getting the disease at this point. So.
Thank you, Usha, Madam. Okay, and next is Dr. Prasad Garimalla. He is a pulmonary cardiologist in Atlanta. Sir, can you give update how many number of cases there in your hospital, etc.? What is the seriousness there? Thank you.
Thank you again. Thank you, Lokeshji, and thank you, Dr. Reddy and AAPI administration, and for giving the opportunity. The question is how many we have in Atlanta area. We are a private hospital, Northside Hospital System. I work in 2 hospitals. One of the hospitals has 24 cases as of today. Other hospital has 10. So of these 34 cases, about 10 of them are in the ICU, 10 plus another 4. So 14 are in the ICU. The rest of them are all in the different floors. So one of the biggest problem that we had was the turnaround time for the testing. It was taking almost 6 to 7 days for the results to come back. But in the last 2 days or so, yesterday and today, the turnaround time was decreased to 1 day or even less. So that is a big game changer for us at this time. And from the audience point of view, I want to tell one of them is like go with an attitude that all of us, every human being is a healthcare worker at this time. That's the best attitude. If you want a healthcare, if you go to a healthcare worker, a doctor or anybody, you want them to do the best. So we want everyone, every human being to do their best and act like a healthcare worker. And otherwise it's harder and we'll have to go through this pain longer. Thank you.
Thank you, Dr. Prasad. Dr. Champal Chaudhary, sir, he's a professor of psychiatry at Rosalind Franklin University, and also, can you speak a few minutes, sir, Dr. Chaudhary?
Thank you, Dr. Idra. Can you hear me?
Yeah, yes.
Okay, thank you. Well, good evening, everybody. We are all in the midst of an unprecedented pandemic, and social distancing has become the norm, with many people confined to their homes and their and then worrying about staying in their own place. along with concerns about what's going to happen to them, what's going to happen to their job, what's going to happen to their finances, and what's going to happen to their future. So worrying is common and is an understandable reaction to what's going on in the world today. But there are a couple of things that we can all do that will help us out. First and foremost, social distancing does not mean social isolation. Today we are a connected world, and we have many means of reaching out to people all the way back home from here. So keep in touch with people, keep in touch with the loved ones, touch base with people that you have not talked to within a while, and renew your acquaintances. And so keep active, keep busy, and keep connected. I think that's an important thing. The other thing I would like to tell you is that do not get overwhelmed by the information all around you. There is a lot of noise that's going on for information, so please be careful about it. Don't depend on WhatsApp and Facebook as your sources for information. There are better sources for information, and look to credible sources, and do not pay attention to social media feeds, and do not contribute to the noise yourself by indiscriminately forwarding things that are not verifiable. Okay. And mental health is available, and help is available all across the country. The government and the SAMHSA have relaxed many of the standards for care. So mental health is available. Mental health help is available more so than ever. So please make use of it if need be. I'll remain and be available for later. Thank you.
Thank you, Dr. Chaudhary. So we have other two speakers who are still waiting. Dr. Einstein Arunachalam, he's he's emergency room physician. He's in Washington, Seattle. When the first cases came in Seattle, he saw patients, maybe a few patients in ICU now almost went 60. Dr. Einstein, sir, can you elaborate the current situation in Washington, Seattle? Go ahead, sir.
Thank you, Dr. Lokesh. I thank again AAPI for giving me an opportunity to speak. And right now we have about 88 patients admitted in our hospital who are COVID positive, and about 22 patients are intubated and are in the ICU. And I worked yesterday, and I saw about 20 patients. About 10 patients are COVID positive. So almost we are seeing a lot of patients. It is exponentially increasing, and it is also spreading very widely among the family members. So it's if anybody has symptoms like sore throat or cough, they need to get tested, and they have to isolate themselves. Like they have to wear masks, and the other family members also have to wear masks, and they have to stay in their room and separate bathroom, and they have to wash their hands. Everybody has to wash their hands. So going out, we have to minimize going out, and we have to go out only to buy essential things and things like that otherwise. And wash the hands frequently, and also if anybody has any respiratory symptoms, to wear masks. That will greatly decrease the chance of getting the infection. I am available for any questions.
Dr. Einstein, sir, that we talked this morning, in your emergency room, every patient, not necessarily patient, every patient come to the ER, you are putting mask on the patient. So do you suggest Japan, we saw only 1,500 COVID positive with, I don't know how many million people. They have high use of masks. Do you think we were ready to tell everybody to wear mask outside or whenever you see anybody talking? Can you give your opinion because you are in the front line?
Yes, I am of the opinion that everybody should wear a mask because a lot of people are asymptomatic, and even COVID symptomatic patients, they are asymptomatic for about 5-6 days, and then they get symptoms. And there have been a lot of papers from China, and that asymptomatic people have transmitted this disease. So if everybody wears masks, even while talking, or they will not, there won't be any droplets which come out. So that will decrease the chance of the spread of the disease everywhere in the community. So I am of the opinion, and based on the research done in China, and that's why in Hong Kong everybody is wearing masks, irrespective of whether they have it or not, because most people don't know whether they are having it. Most people will have only minor symptoms. And Hong Kong, Singapore, Japan, Taiwan, and in China. So in these places, everybody is wearing masks. So I also strongly advocate everybody to wear masks.
So the take-home message here is, I just looked at it, 1% of Iceland, we are positive. I mean, they randomly did 1%. In Italy, where one of the started, northern Italy, there is 3% of the population are positive. So when you go out for, one of the take-home messages, when you go out to shop with these groceries, what we are suggesting is mask. You don't have to have surgical mask. I think there is something we'll talk about. Even 3-4 layers cloth mask is better. That's all you can get now. Maybe I will request Dr. Anuragji, so maybe this information to pass on to higher officials in India. When these people coming out, thousands are coming in 2 hours to buy the groceries, and they don't have anything. Even the self-made will help some. That's what we believe. Next, I will stop there about the master, because this very important point of all this 1 hour meeting. This is the most important thing we thought with addition. I wrote a letter to Governor of Michigan this morning too. Dr. Bharat Parai sir is here. Sir, Dr. Bharat Parai, can you add? Can you speak a couple of minutes, sir?
What do you want me to speak on so I can address that particular issue?
Well, Dr. Parai is oncologist from Indiana. So anything with this issue, sir, we just anything on this issue we can able to.
Okay, so
Bharatji, speak as a community leader also, Bharatji.
Okay, so what we have to do here for people to recognize that this is a aggressive type of respiratory virus, we should take appropriate precautions because it is affecting a lot of people. My personal feeling is, because of the transmission during the asymptomatic phase, a lot of people are going to be positive when tested at random, but most of them will have very minor respiratory symptom, no different than what they get when they get cough or minor upper respiratory tract infection. So those are about 80 to 85% of the people who will get infected. About 10 to 15% will develop the more symptoms and will end up in the hospital, and about 4 or 5% will go on the ventilator, out of which 1 or 2% will not make it. Majority of those who won't make it are elderly and who have comorbidities, but that's not always the case. Some of the younger people have also gone on the respirator and unfortunately died. So taking appropriate precautions is important. I don't know how it's going to be solved. What the approach that India has taken is very commendable. We know that this virus is communicable in the first 5 days. It may be shedding from the host who has been affected for about 14 days. The longest duration of virus alive that has been recorded was from the Diamond Princess cruise, where it was found to be present up to 17 days. So we know that this virus generally does not, or to the best of our knowledge, doesn't live beyond 17 days. So the hypothesis of Modi ji about 21 days is that, okay, you remain isolated. If you don't have infection, you don't need to worry about it. Those who have infection,
even if they're asymptomatic, by day 14, they will get cured without any specific treatment. And those who develop symptomatic disease will end up going in the hospital and they will get isolated there. So that is the hypothesis or theory behind 21-day isolation. And we will see that should significantly drop. And the other important thing, which unfortunately is not happening in USA, but I wish would happen, is to quickly test people, have a quick turnaround time, and those that are found positive, put them in isolation so that rest of the people don't get infected. And the other test that I would like to see is the antibody test, those people who have already developed immunity, because it's quite possible that millions of people may have already developed immunity because of asymptomatic exposure to the virus. So those people that can be tested and be told, okay, you have the antibody, you are immune, then those people can become more active in the society, while those that don't have antibodies should realize that they are still susceptible. So I think this kind of quick testing, both for diagnostic as well as those who have developed antibodies, would help people become less fearful. Therapeutic thing, they are already in the progress, so I don't want to go into the detail of it unless somebody has a question on it.
Okay. Thank you so much, Dr. Bhargava. We have now we start questions. Some of them, there's so many questions coming in. How long does the COVID stays on the surface? I think Dr. Bhargava already answered, between 3 days to almost 17 days. And if there are not enough kits yet, can we not take X-rays, not wait until patient develops breathing symptoms?
So on that note of the surfaces of how the bacteria, how the virus lives, so it usually, just a little input on that, it survives about like 36 to 72 hours on plastic surface. And usually on cloth surfaces, it survives about 12 to 24 hours, you know. And on paper, I know a lot of people had questions regarding, can we open their mail? Can they open their mail which comes? And what if the person who delivers the mail has infection, right? So on paper, it survives about for 24 to 36 hours. This is out of WHO website. And then, people who want to be, who obviously opening the mail and washing hands after that is the way to go if you're thinking about contaminated surfaces, you know. And any disinfectant or EPA approved disinfectants can kill the virus in less than 5 minutes. Obviously washing hands after we touch the surfaces is more appropriate too. So.
How about these when they go out and buy the groceries? Do you have anything to say, Dr. Vegetables?
I'm sorry, who did you ask?
Usha, can you answer the vegetables when they buy? Most of the people go and buy their vegetables, groceries. What kind of precautions they take? That's one other question.
Yes, obviously when we go outside, obviously we want to minimize how many trips we make outside of our homes, and the surfaces we touch outside when we come back home. We should probably do either alcohol, alcohol content of more than 60%. Of decontaminating our hands and also hand washing after we bring in materials from outside, you know. So, again, a lot of the packages, the viruses do not survive too long on the packages. So, on the vegetables, you can, obviously we're going to wash our food and eat, which should take away most of the viruses or any bacteria. With adequate washing and adequate preparation, we should be able to eliminate most of these viruses which survive at this time. So.
Okay. Thank you, Dr. Usha. The other question they are having is, this question to Dr. Anurag or Dr. Harish, is the Indian Embassy working with USCIS to take care of H1 holders whose visa are going to be maxed out during this time? and for them, permit is in progress. Due to this COVID-19 situation, we are losing the time. Yes, CIS is not working. Yes, CIS looking any options to extend our stay without I-140 after X out. Please advise. Hello.
Hello.
Hello, sir. Go ahead.
Yeah. Hello. Can you hear me?
Yeah.
Yes, I can hear you.
Anurag, Minister Committee Affairs. As I had mentioned in my opening remarks, that we are taking up the issue with the US government on various categories of visas where the problem is being experienced. What we have been advised by the US side so far is that they are working on the issue. It's an evolving situation, but people who are in need, they should apply online, and they will be working, and they should be coming out with a set of guidelines on the issue in the coming days. They have also advised that from time to time you should be checking on the USCIS website on the issue or the guidelines which are coming to notice. So the short answer is that it is not a categorical clear answer from the US side, but yes, embassy is in touch with the US government on this issue and bringing to their notice all such issues which are coming to our notice.
Other question, Dr. Anurag ji, one of our callers' parents are visiting from India, and my mom's passport is expiring April 19th. She will need something if she has to travel after 4/19.
Vinayak,
I think we can deal with that. We can deal with the situation.
No problem.
What can happen is, given that the person's mother is living in DMV area, they need to contact the Indian Embassy. We have uploaded our email address. They need to send the details, including a copy of the existing passport, stating clearly that the passport will be expiring shortly, and then we will respond to them, guiding them the next process, and we'll do the job.
Okay, thank you so much. This question is to the doctor. So, this general question, a lot of Indian citizens in America who have insurance and everything, when they go to the emergency room, even though they have health insurance and everything, they're not able to taken care of it because they're all treated the same. That's what they're worried about. Can anyone answer, Dr. Prasad?
I'm sorry, I didn't get the question.
All Indian citizens in USA face one issue. They show symptoms. All the hospitals, nursing homes put a signboard, please call some number or go to the ER. Right now, the situation in USA, when you reach emergency stage, that's when you will be admitted to the hospital. I can partly answer this question. Current situation in emergency rooms, all small, especially in the New York, almost 90% are full stage. They're making more beds. If we have COVID positive patients, 85% have mild symptoms. That means fever, muscle pains, those symptoms. Those are the patients when you go to the emergency room, they will have a screening person, and then they will tell them go home or give some medicine. But other 15% may have hypoxia. So whether you have insurance, whether you are a student, whether you're an illegal person, whether you're a senator, they are all treated the same way. And once if their oxygen needed 6 liters, then one ward they go and they put intubation. And intubation, they will be lasting at least 11 days. And there's significant crisis on the healthcare. So this question, can you expand answer, Dr. Prasad, or after that, Dr. Einstein, about this question? Because these people, we have insurance and nobody taking care of us. That's the bottom line.
If you don't have severe enough symptoms, there is no reason to go to the emergency room. But, if you have symptoms like shortness of breath or high fevers, then definitely go to the emergency room. It will be taken care of irrespective, like Dr. Lokesh Idra said, you will be taken care of. And I think it all depends on the severity. So there's mild, moderate, and severe. Mild people are self-quarantined in the houses. Moderate people will be admitted to the floors. Severe people will be admitted to the ICU.
Dr. Einstein,
Yeah. So, anybody coming to the emergency department will be seen by an emergency physician, and irrespective of the insurance, and I don't even see what insurance they have and all those things. And most of the people, if they have mild symptoms, we do the test and we send them home. And if they are like hypoxic, then we admit to the hospital, and if they are like severely hypoxic, they will need to be intubated. But there is no problem. If anybody has severe symptoms and needs to be seen, they can come to the emergency department irrespective of their insurance. They will be taken care of, and they will be taken care of. There is no difference. The insurance doesn't make any difference regarding the medical decision making.
Yeah. I think to add a little bit for that, so when you have, say for example, you're in a family 4, 3, 2, whatever, when you have cold, what are you going to do? Anybody have cold right now, maybe 20% is COVID, 80% not. So you have to isolate that person in the family and put in a separate room. Dr. Einstein said first, you have to work like a doctor, and then you have to treat like a doctor. Because what his experience is or other people's we're hearing last 2 weeks of conference calls. One family member affects 90. I don't know the percentage. Significantly, majority of the family members will affect because they're not isolating that person separately. That's one thing you can do. Next, okay. Is anyone want to add anything? Please let me know.
If any family member is affected, tested positive, the recommendations at this point from CDC is they are in a separate room. It's not like if you're positive, you just walk around the house and do everything as usual. So you have to be in a separate room with a separate bathroom, and you should obviously keep the distance and confine yourself to that room if you're tested positive. So that's
this question to Dr. Usha is: can I take a walk outside in a child's self-isolated situation?
Oh, if you're tested positive.
No. Any person, like everybody, can they go outside, take a walk?
Oh. Yes. Again, we know like a lot of these situations, when the weather gets warmer, there are 1,000 people outside in the same place trying to get a walk. That is not recommended, obviously. But definitely walking in your neighborhood, walking in your backyard, still maintaining the social distancing is the way to go. Definitely a walk outside for mental health is much needed at this time, so.
Sure. And there's a question about healthcare workers, nurses and other healthcare workers are worried about lack of PPE. How do you deal with that fear factor?
Well, I think the media is, from my standpoint, from an infectious disease standpoint, we are in a smaller setting in Pittsburgh. So far, we are not overwhelmed with the cases. We have a few, but so far we have adequate PPEs. But the situation in major hospitals, especially in New York, where the situation is grim and more cases are coming, definitely the deficiency of this PPE is worrisome. But, from my learning of this situation, I think the government, they are working on to try to provide as much as possible at this point.
This one also to you, Usha madam. The virus stays 2-3 days, sometimes in the ships, also 17 days. However, that was just a viral RNA. We don't know that this was ineffective or active or not.
Also, yeah, like the other doctor was saying, I did read an article where the shedding happened. They were positive RNA for almost 17 to 21 days, But the usual period of the disease is like up till 14 days. So that's why the quarantining here is 14 days. You're asking if the virus survived the 21 days? Is that what you're asking, Doctor?
That question is RNA particle. Isn't it virus itself is an RNA?
Yes, it is an RNA virus, yes. Mm-hmm.
Which has fat above it, and that can be, that fat once dissolves, the virus dies, the RNA particle. Yeah, that will be the answer. Well, this is a common question. A lot of people live in apartment, centralized vents. Can the virus travel through centralized vent system in the house?
Central. Again, the particles, you can only get the centralized system in the, if you're letting, again, the virus is more contagious if the droplets, it's spread through droplets. So the droplets, you have to be, that's why the distancing is, if you're more than 3 feet, you're at less risk, so. Sure. I cannot for sure say, but I think it's very unlikely that the virus travels in the vent, and if you're on the other apartment, it's going to infect you.
Okay, thank you. The same question, a lot of people are scared to go to ER, emergency room now. What point would you advise people to go to emergency room department? I don't think you need to go afraid to go to the emergency room.
Monitor the oxygen if you can, or monitor the vital signs if they have the fevers and cough, and then they're feeling short of breath. At that point, I would strongly recommend they need to reach out to somebody. At least have a telehealth visit, or talk to the primary care physician, and depending on the circumstances and underlying condition of the person, they may advise better.
Yeah, and also they're screening differently. They're checking few questions outside in a tent or something. So if there's a big line of the patients, then I'm worried. But otherwise, they all will be taken. They know they're treating, like Dr. Einstein said, everybody. Dr. Einstein, can you add on that? People are afraid to go to insurance. Not insurance, going to ER. Can you help me out?
Yeah. So the main thing is, if they are having severe shortness of breath, then they need to come to the emergency department, because some of them are hypoxic. And otherwise, main thing is to call your primary care physician and then get their advice. And most of the time, if they call the primary care physician or a telephone hotline, those people give the correct advice, and most of the time. And if I see a lot of people getting scared, like there are like few patients who are COVID positive, and we had discharged them home, and they watch the TV and all those things, and then they are like, I see some of them come back to the emergency department with like panic attack, and they are like saying, "Oh, I can't breathe, I am dying," and things like that. So,
okay.
If they are concerned, they should come.
So this other question, same, I think you probably can answer, or anyone. Healthcare providers, like doctors who work there, and in India, they're not allowing even to the apartments. Modi ji have given strict warning, and also even given life insurance for them too. What precautions healthcare provider, when they come home, what do they do? Do they isolate themselves? I'm sure some of them. I have one ER doctor from New Orleans. His wife went to his parents' house. He's alone because there is a risk for contamination. Dr. Einstein or Prasad, anyone can have expand on it.
So in the hospital, I go to the hospital. They provide me the hospital scrubs, and after my shift is over, I take out the scrubs and I take a bath in the hospital, and then the shoes I already wiped out with bleach wipes, and then I come home. Since I am treating a lot of COVID patients, I self-isolate. I live in a separate room, separate bathroom, even if I don't have any symptoms, and that's what I am doing.
Okay. Now, Prasad sir, can you answer? What do you do when you come back from the hospital?
Same thing. We are doing the scrubs, and then basically plan it ahead of time. So everything that I bring from the hospital, including all these protective gear and everything, my stethoscope and everything will be in the garage. I don't bring anything inside. Try to wipe it, wash my hands frequently, and basically, when I go to the hospital, wear protective gear all the time, as much as especially the mask, and the gloves. That's what I'm doing, and minimize the areas. We have one exam policy in the hospital, which is very good because if there is a prior practitioner provider who saw the patient examined, we are not even going inside, using their exam as our exam. And, I think, universal precautions and, it's a droplet precautions predominantly. There was a lot of concern initially in our hospital that the hospital was not providing N95 masks for the healthcare providers. But CDC guidelines and WHO, everybody is saying it is basically droplet predominantly unless you are doing an aerosol generating procedure like intubation or bronchoscopy or, positive pressure ventilation. So around those times, I think asking for the, the proper equipment so that, and done in a negative pressure room, that those are very useful for the physicians. But once we come home, I think getting rid of the scrubs at the earliest point, and then some doctors are doing this complete isolation where they are eating at different times. They are not eating with the rest of the family members. We are not following that yet.
There's some questions is just isolating yourself at early symptoms fix the person without any medication? I think that answer we talked about. If 100 people have COVID, 85% have mild symptoms, muscle aches, cough. So usually they need Tylenol and something like that. But if you have more symptoms, then you have to go to the hospital. I think 15% of them need hospital care. Yeah, next question they ask is it recommended to get everyone tested as a safety measure? No, I don't think they can able to do it right now. Even the sick patients, the tests are waiting 1 week.
That will be the ideal scenario where everyone gets tested. We know what's the prevalence of the COVID in the community. That way, we can actually more accurately predict what would be the mortality of this disease, at this point. So we definitely, even now, we don't have adequate testing, and every test we order, it has to be screened by another healthcare provider to see if the test is appropriate or not. But it'll be an ideal scenario if we can screen the general public also to see the prevalence.
This question is to Anurag ji. Go ahead.
Dr. Barai, one of the difficulty about the test, it tells you what your status is today, and that may give false sense of security to people that, oh, I tested negative.
Yes.
So they can get infected second day or third day. So that is the limitation.
That is true.
Yeah. This question to Anurag ji or anyone from embassy, what would consulate advise if a H1B worker from India is laid off, unemployed during this crisis and will not be able to get new job before stay become illegal? I think not only H1, even ourselves, we're all employed now. Okay, go ahead, sir, Anurag ji. Or anyone from Consulate General.
Okay, I will try to answer this question. We are looking at a situation where someone who had been holding a certain working status, be it H1B or any other work authorization, which got over by virtue of expiry of the term and not getting an extension or cancellation by any other means, then the individual will be required to leave the country within a certain timeline. Now, considering the lockdowns and the travel restrictions, it may not happen immediately. We are also looking at a possibility where the H1B visa holder initially and his spouse, maybe Indian passport holders, but their children who are minors, are US citizens and holders of either OCI card or waiting for a visa to India. Now, from the embassy side, we would like to process this family members' visa cases at the earliest on priority and facilitate their going back to India. But if we are looking at a situation where despite their desire to go back to India, they're not able to do so, the process is to once again, as advised earlier, apply to USCIS for extension of the stay. The extension of the stay could be sought by two ways. One is to convert the H1 visa into a B1, B2, or at least mention that owing to the current restrictions, the individual is not able to travel back immediately. So the CIS could grant that person a leeway of a month or two. Now, what we have been given to understand is that there is no blanket approval for every applicant to get it approved, but the USCIS would definitely take a note that the individual, in all its sincerity, tried to make his exit as legal as possible and was not a willful violator. Currently, we don't really have a perfect answer to any of these queries, but one would suggest these people to approach the USCIS at the earliest and seek an extension or a conversion of visa so that the request remains legit and the person does not face adverse consequences at a later date.
The other question to consulate, if some of them green cards people, they have to come back within 6 months or something, the parents, they're stuck there and the spouse is stuck there, if they expire again, what do the US consulate will do? Can we request them to look into that too, sir?
Now, honestly, this question needs to be addressed by the US Embassy or the US Consulate back in India. The Indian Embassy here or the consulates here don't really have a jurisdiction to intervene on their behalf, but certainly they should be contacting the USCIS as well as the local US missions in India to seek more clarity in this regard.
I think you're right. We may have all the our Indian organization go to the Congress, write letters so that way that can be waived because of the crisis. That's what needs to be approached. Paul, let me see, Harish. Dr. Paul from Embassy will talk about insurance, students, parents. Paul can you unmute?
No, this is Dr. Paul, cardiovascular specialist.
Go ahead, sir.
Oh, I
Hello?
think Paul is on mute. Okay.
Oh, you have to give the number to Vijay Garu, then he'll.
He's in.
Yes. So can you repeat the question for me?
Oh, this cardiologist? Okay. Oh, okay, I thought you were supposed to make a statement. Any question? I'll give the questions as I go. There's so many coming different ways. Okay. Any information using monoclonal antibodies to recover patients as a mode of treatment to oncologist? I can add IL-6 is one of the major cytokine burst, and that's probably one, and they are trying to approve IL-6 blocker. I forgot the name. That's the one. Dr. Barai, can you answer any of?
Yeah, we are using tocilizumab.
Oh, okay.
That is the IL-6 blocker, and patients who are severe ARDS, they are being given this tocilizumab.
Oh, okay.
Yeah, in China, I think they gave it to 20 patients and 14 patients recovered, with severe ARDS. And from Italy also, they say that they have good results with this IL-6 blocker.
Okay. Dr. Suresh, can you ask?
Yes.
Go ahead, sir.
Thank you. My name is Dr. Suresh Gupta, calling from Washington. I practice clinical medicine past 35 years in Washington. We ourselves, we're a practice in hospital setting. We have 46 ICU beds, and we do have plenty of positive COVID. And we follow patient every day. I have one question. It's a burning question, which I've shared with my colleagues in infectious disease at my hospital, and including the most controversial thing we are dealing today in US, in India, and all over the world is prophylactic treatment versus real treatment. How do we treat inpatient patients in a hospital ICU, whether the SCQ or Zithromax, we all know what we do, and or the question is what is said in the public or media, Facebook or WhatsApp, the question about chloroquine versus hydroxychloroquine as CQ was CQ. Honestly, I mean, this needs to be clarified. This needs to be discussed. I'm attesting our Anurag is listening, and that's why he's been acting. I have been sharing this information with India, our foreign secretary, Ambassador Simla. Honestly, this needs to be sorted out today so we can all learn and share and teach and share with others, which is a really big hoax. I mean, one patient died in Arizona, we all know that. Now, please clarify and discuss this out with esteemed colleagues we have on the line. Thank you for listening.
Sir, about the prophylaxis, we're hearing different thing. In the USA, they're doing studies. I think cardiology, Dr. Paul can answer this question.
Yes, thank you so much for having me online. So from my end, I had a couple of questions today in terms of prophylaxis, and I'm not sure if you're aware, there's a physician that actually are buying to prophylax themselves, actually in a situation in New York to ensure the fact that they are safe to continue to take care of the patient. So the government and the pharmaceutical companies are now stopping that altogether in regards to ourselves prophylacting so that we can take care of our patients. The data for hydroxychloroquine from a cardiovascular standpoint, it's in terms of combating this coronavirus is very promising. But in my area, cardiovascular and electrophysiology, in the last 3 days from our sister hospitals, we had 3 cardiac arrests due to VT because of QT prolongation. So I think mass prophylaxis without knowing the patient's risk is extremely harmful. Therefore, prior to all of this, I think, critical thinking and common sense tells you that we have to look at we have to know who's low risk, moderate risk, and high risk. And at this point, with the quarantine and without knowing the patient's background, it's extremely hard to looking at clinical profile and decide who we should prophylax at this point. Obviously, the treatment is easy is because if you're dealing with, like in New York, and I'm in Chicago, Illinois area, and we're expecting 40,000 of these cases coming our way. Obviously, what hits the hospital is going to be majority of the positive cases if they're sick. But mass prophylaxis from a cardiovascular standpoint, at this point, we are not embracing that at all.
I think there is no way you can discuss or finalize here this kind of, we don't know the answer, sir. I think in ICMR, they are recommending in India prophylactic and treatment, so we cannot speak to the Indian treatment here. Here is the QT prolong is there very well, and those who trials going on USA, I heard from other meetings from esteemed cardiologists and pulmonologists, they are checking EKG almost frequently. In these patients, it's even hard to check EKG on a daily basis.
Right. The problem.
Go ahead, sir.
The problem here is that checking EKG, it's fine when the patient's in the hospital, but I think that once we have testing and prophylaxis, it might be in a nursing home or a senior citizen facility that checking an EKG may not be, it's self-limiting because of resources.
So what I was going to add is that, everything in medicine is based on the evidence. So right now with only 20 patients or 30 patients, it's not even considered a study. It's more like a case series. It's very hard for us to come up with any clear-cut guidelines that this is the treatment immediately. As more and more data comes in, we'll have more clarity. At this time, with the limited information, that's why there is a lot of confusion. And chloroquine, the Plaquenil or hydroxychloroquine is not even available in many of the outpatient pharmacies. So one of the problems we have right now is like we are treating them in the hospital, and if they have mild problems or they have improved to the point of discharge, at that point, because they cannot get the medicine outside and we cannot monitor their toxicity, like Dr. Paul said, sending them home on both the medicines like Zithromax and Plaquenil is going to increase their risk of QT prolongation and cardiac arrest. We are stopping that medicine in the middle if they are stable. That's it.
The other thing I would like to add is One of the other manifestation is viral myocarditis, which people across Europe and people in New York have been seeing. People are coming with arrhythmias, and viral myocarditis also seems to be a common presentation here. So again, that's something we really have to watch out for when we are even considering a treatment with hydroxychloroquine in this setting, leave alone the prophylaxis at this point. So.
Yeah, absolutely. You know, the inflammatory cascade is horrific, yes. And it's triggered so abruptly. In the hospitals that we haven't had a positive COVID case yet where I'm practicing, but we are, under the Northwestern banner, we're putting things reverse flow and ventilation for our patients. But again, when I walk through the hallways today, my emphasis here is that the more we know about coronavirus, the fatality from the Italian experience is getting less and less. 6% are dying from their end in terms of respiratory, but 10 to 17% is now cardiac. So as a reminder, the biggest problem that we have in our ER today is that there was a 47% reduction in chest pain admission. So we know that patients are staying home with chest pain and with acute coronary syndrome, with certain things that we normally treat on an acute basis because of the concern for coronavirus. So to my esteemed physicians here, I think still cardiovascular care, respiratory, infectious disease that we normally treat on a day-to-day basis that put our patients harm's way remains still prevalent despite coronavirus.
Yeah. Next, Dr. Thelma David is unmuted. Can you unmute? First secretary from Indian Embassy has joined.
Yeah.
And we're very happy.
I'm talking to her. I think I'm trying to figure out. You can ask a couple of questions in the meantime, please.
We're happy.
I will ask a question. Let me ask a question from one of the callers. What's the advice for an asthmatic healthcare worker who is on Advair, single-layer Claritin and Ventolin daily? She is a healthcare worker and is worried about exposure. Would you recommend staying away from the work? She gets asthma exacerbation at least once in every 2 months, and the hospital she is working has more COVID patients.
I'll take that because inhaled corticosteroids is a primary treatment in asthmatic, especially if he's having exacerbations that frequently. So continue the inhaled corticosteroids at this time. If he is concerned about it, he should reach out to his pulmonologist, allergist, or internal medicine doctor, whoever is taking care of him.
Thank you. I can hear that.
Yeah. And basically assess the risk, and with the COVID exposure, he may be at higher risk, so then they can probably give an excuse for them.
I can answer being an asthma allergy doctor. So I have two patients called, their asthma not controlled. I gave a letter to them not to work a couple of weeks. I definitely work different place, but I think they're at home. That is, if they are not controlled, if they are controlled well and things well, I think they're not asking us for any other request. Yeah, that's good. Dr. Thelma, please go ahead. Is she unmuted?
Yeah.
Okay.
Hello.
Yeah, go ahead, madam.
Yeah. Thank you for letting me also join. And I think you would have already heard from our Minister Community Affairs, Mr. Anurag Kumar from Embassy, and we are all here to be with you and help you in all these efforts. Thank you so much.
Okay. There is a question from Dr. Poonam Korpe, from Johns Hopkins University regarding Indian National Guidelines treatment of COVID-19. Different institutes are recommending antiretroviral medication, Kaletra, K-E-A-L-E-T-R-A. However, we now have data including randomized control trials showing this drug did not improve time to cure and did not result in reduced mortality. Can you tell us who is creating the recommendation treatment in India? The answer is, I think most of the to our knowledge is ICMR. We saw that. ICMR is the only thing we can know, but we don't know much about India. Is anyone can answer this? I mean, can you add on to me?
Yeah, I think with the few information I got with the prophylaxis, it's ICMR, the paper I saw. But about the Kaletra, which is an antiretroviral HIV-based drug, I think they used in one of the patients who recovered in India, but also in China, they did, it's an NEJM article in the second week of March, which showed it did not improve any viral clearance when compared to placebo, So Kaletra was one of the thought out drugs, but not really as effective as it was thought, or in fact not effective at all. So.
There's one question. Can someone, probably this question every Indian would like to know. Someone please highlight the effect of temperature and COVID-19. We see limited transmission of virus in warmer regions compared to colder regions. Anyone can answer that? That was warmer versus colder virus.
Yeah, so
go ahead.
Here in the United States, we see that there is less number of cases in Florida and Texas when compared with New York or Washington or Michigan. So, the water climate might decrease the spread of the infection.
So the theory behind this, usually the common cold, common respiratory viruses we see, is usually we see cluster of these cases in the winter, but as the warmer weather gets, obviously we are outside, and also because this is spread through droplets, right? In the setting of humidity, where the droplets get heavier and they are not so easily transmissible as in the colder weather. Okay, that's one of the reasons we don't see much of these cold viruses or the common cold viruses in the warmer seasons. But with this novel coronavirus, I think it's just too early to say at this point that it is going to get better. Again, it's if you have to say scientifically, we don't know yet. That's what the CDC says. That's what the WHO says. And India, I feel, in a perspective, the cases, they are 2 weeks behind us, So it is not, I just don't feel right to say at this point that warmer weathers, but we have seen in the southern hemispheres, there are much lower cases at this time. But is it, I don't know, I do not understand yet if it's from the weather or not. It's more likely the testing and all those factors play a role at this point.
Sure. Other thing I want to add is in Louisiana, Mardi Gras, one of my friends wrote to them, I think he said, don't conduct a Mardi Gras where 1 million, 10 lakh people came. And if you see in the statistics and world meter, Louisiana is high. One of our friends supposed to come, but he could not because he's in small. And Louisiana is highest number of cases in the small state. So warm weather alone won't help completely. If you have a lot of people together, that will not help. So the concern I have is in India where they leave to go to groceries, thousands of people in one market. So that's what my concern. But anyhow. Then a lot of questions about when can OCI will be renewed, allow, and all the when can you lift the banners. So I would explain to everybody, do not worry about. They all will be taken care, I think, because first worry about not going out, take this precaution. This is a life issue. These other questions will be answered as the time comes. I'm sure you can check the websites of the Indian Embassy. I think if Embassy like to add anything for that question, let me know. Because there's not much anybody can do or anybody can go out. They're all on virtual meetings. The other question, do you recommend taking Advil, ibuprofen for pains? This is a very good question. Can anyone answer ibuprofen for pain? I can answer that. Ibuprofen, they said do not use ibuprofen for pain, Tylenol, acetaminophen to be used, because there are some cases the ibuprofen people they did much worse in Italian studies than others. So absolutely we're recommending not to use ibuprofen, aspirin, naproxen, that's all. If you have fever, just Tylenol and talk to the doctor. That's what their recommendation. Any other question, Anupama or Harish? You can ask.
Hey, I'm Sunil Singh. I have a small question. We have a lot of students here, some H1, like we heard just now that they have expired visas, they lost their jobs. There are some people on visitor visa that doesn't have insurance. Is AAPI doing anything for these people who doesn't have insurance in this country, or visiting, or students, or those kind of people?
Currently this meeting about COVID, if you have any symptoms, I think whether you have insurance or not, you can go to the hospital, they'll treat it. The rest of the insurance is not the topic we're talking today. They are charitable. I can answer that question. There are some charitable clinics, a few of them, which are there for uninsured people. And a lot of our doctors, when they see us, in my office, if I see them, usually I don't bill and courtesy see some of the, even not necessarily Indian or students, anybody, we try to do that. But one problem is a lot of doctors are employed by the hospitals, and then we have no role, the hospital rule we have to follow. Unfortunately, 80% of doctors in America are employed by the hospitals, and then we have to follow the hospital rules.
Okay, thank you.
Because, yeah, that's... Anupama, do you have any other... I'm sure I have... Okay, is any...
Hold on, one question. When they talk about older citizens with underlying conditions or at high risk, question, do the conditions have to be chronic? If so, which ones are prominent one?
Diabetes mellitus, hypertension, congestive heart failure, any pulmonary or lung-related conditions are the more prominent ones. And then
and renal failure.
Renal failure and medications that are going to suppress the immunity, steroids or chemo medicines, anything that suppress the immunity or the other.
Okay.
Yes, go ahead.
Another question. In China, there is cure for 75,000 COVID-19 cases. Do we know what medicine they used to cure the COVID-19?
They did not cure it. I mean, there's a natural progression like many viral infections, 80% of them. I think they also had mortality. Average mortality is about 3.8%. If they are above the age of 80, 15% people die. I don't think there is a specific cure in the form of antiretroviral therapy or anything that we know that Chinese knew that we did not know.
Next question. This is from the to the embassy. This question is from Dr. Saraswati from Boston. I'm an American citizen and my visa to India expired. If I have to go to India on an emergency basis for family reasons or as pulmonary specialist for professional reasons, would I be able to get an e-visa to India, please? E-visa.
I think they already. Go ahead.
I believe they have left, but I can answer a little bit to my knowledge.
I'm here on the call. Can I answer?
You can get the visa. Yeah, go ahead. Go ahead, ma'am.
Yeah.
Can I answer, madam?
Dr. Selma from the Indian Embassy. So, the requirement to travel to India, the Indian Embassy is still considering applications on a case-to-case basis. But I think you will also appreciate that currently there has been restrictions for international flights to land into India, except for official purposes. That is, if there is any special chartered flights that is being organized by each of the governments. So, but if there is some exigencies, please do reach out to the embassy, and we would be happy to see what can be done best in the situation.
Okay. This question to Dr. Einstein. Can someone clarify symptoms of COVID-19? Fever, dry cough, shortness of breath. One have to have all these, or just one symptom is all also can fall into COVID-19 or any other symptoms? Dr. Einstein.
Yeah, like most of the people come with some dry cough or shortness of breath with fever, and sometimes they give history of fever, and here the temperature is normal. And I had a patient who came with just cough, then he spiked the fever while he was in the emergency department. So, and one patient had came with just myalgia and diarrhea, and then 2-3 days later he developed shortness of breath, cough. So it's not that everything is required. People can have just myalgia and cough, or fever and myalgia. So there are different presentations.
Next question: how long they can shed the virus after they're symptomatic? Usha, Dr. Usha.
Yeah, that's something we talked about, right? I mean, usually it's for 14 days, and sometimes they've been shedding for almost 21 days. But on the other side of the curve, obviously the viral load is much less, Earlier in the disease process, when you have the symptoms of fever, cough, your shedding is much higher at that point, So you're more contagious at the point, like in any disease, so.
Yes.
So usually you're contagious in 14 days, but some of the studies have shown longer viral shedding in some cases. So.
We will going to have another 8 minutes maximum because of the call and time, everybody's contribution. Next question, Anupama, do you have any question? Or anybody like to, our speakers make any statements where we miss any points?
I have a question.
Go ahead.
I have one thing to say. I think at this point, because we are seeing more and more cases, so we also have to keep an eye on these atypical presentations. We are seeing data, people who come with GI symptoms, as the ER doctor was describing, and the cardiac presentations. We had one patient who came with AFib, been in the hospital for 4 days and developed fever, then tested positive for COVID. So these are some atypical presentations. As healthcare workers, we need to more actively keep thinking. At this point, I'm thinking every patient who is admitted, should I be thinking, does this patient need a COVID testing at this point, I think to protect ourselves and everybody else around us. So.
Sure.
The next question is from a student. Hello, I'm an Indian student texting from US. My question is, some sources say that masks can restrict the coronavirus, but some say that only N95 can restrict it. I have heard that N95 is recommended to healthcare employees treating patients. So will trying a scarf over the face or wearing a normal mask help stay away from coronavirus? Also, can the virus stay in the air?
Dr. Einstein.
So the virus, Dr.
Go ahead, Usha, go ahead.
Yeah, so we know this virus is a droplet, not really airborne. So that's something we've known. That means if you're close to the person who is infected, or the droplets stay on the surface and we touch that and we touch our mucous membranes, we get infected. Transmitting through airborne is not been proven unless you're in those aerolizing procedures like we talked about earlier, right? With the mask itself, so obviously the N95 mask, it just says it protects 95% of air entry, or it filters out all these particles 95%. So N95 is recommended for obviously healthcare workers who are in close contact and working in the high risk setting. Surgical masks provide some benefit, but again, I know the other doctor earlier mentioned that he would probably like to see everyone wearing masks. So it is most helpful if you have the disease. If I have COVID-19, if I wear a surgical mask, it is helpful for me not to spread it to other people. All right, but if I don't have the disease and I wear the surgical mask, it provides much less benefit of me preventing from getting the disease. Is that clear?
Yeah.
Yeah.
Go ahead, ma'am.
Okay, I have a,
Wait, Anupama, there's somebody stuck.
okay.
Wow, down about 17%. Of course, the overall market is down, but this specific sector really getting hit hard here. In fact, Seema, the fact that this
I think that's a TV.
Oh,
Okay, I can't understand what it is. So anyway, the next question is from a caller. How to differentiate the sickness between spring pollen allergy and COVID-19 symptoms? Lokesh Garu, you can answer this question.
Well, I mean, just you have in allergies, you don't have muscle aches, you don't have gastrointestinal symptoms, you don't have fever, you have only sneezing. So you try if you take allergy and medication, your symptoms should improve. But also, let me give the timeline. If you have symptoms, once you have the symptoms of COVID, your 8th day, you are in ICU intubated. And your 6th day, probably you will be in the hospital with shortness of breath. 86% have no symptoms, milder symptoms. They won't go to the hospital or they admitted. Other 14% will be there. So that will answer the question.
Okay, thank you. The next question is, hello doctor, can you tell what kind of special measures to be followed for infants care and COVID-19? So.
Usha, madam.
If you're talking about infant, there's again, in general, if you're if you're a lactating mother, obviously wearing a face mask in that situation would help. I mean, I don't know if you're talking about a lactating mother or a regular small infant. I don't know what age, but if the baby is young and if you're breastfeeding, again, studies, you just wear a mask as much as possible to avoid any transmission at this point. If they're uncomfortable feeding the baby, then other methods like a breast pump or even formula can be used. And younger children, like more than 1 year old, again, just regular hygiene. Touching, I mean, it's hard for us to tell the children not to put their fingers in their mouth or, at this point, keeping our surfaces clean, frequent hand washing, hygiene would be the way to go at this point, So,
sure.
Again, decontaminating our surfaces.
We'll hold the question for now. We'll ask for some closing statements. Dr. Jampal Chaudhary Garu, you want to say anything?
Nothing more to add other than what we have told, what I said before. I think the participants, the presenters were extremely informative and their experience actually adds a lot. So thank you all. Stay safe.
Even Anuragji.
Yeah, Hariji, I have been also seeing the messages or the comments which are being posted on the chat forum. First of all, I would like to mention there's an extremely informative, educative thing for everybody, and I think if the combined knowledge which has been attained in this platform is shared with wider community for their benefit, that will be excellent. I'll request AAPI or NCIA to find some way of sharing this information. That is the first thing. One of the queries mentioned about the OCI card holders, that whether visa is needed for the overseas citizen of India card holder. As I mentioned in my opening remarks, the OCI card has been temporarily held in abeyance till 14th April as of now. So and it is discouraged for medical and health reasons that people should travel. In any case, the international flights to India are also not operating till 14th of April. So but in any emergency, if somebody has to travel for bona fide reasons which will be examined, so on that a separate visa would be required. But as of now, please be advised that the international flights have been stopped to and from India from till 14th of April. Please note that this is an extreme step, and all of you are aware that this has been taken under very, very difficult circumstances and difficult decision. There was also a mention about a lot of queries relating to the visa extension and other things. So as I mentioned in the beginning, that the issue has been flagged with the US authorities, US government here a number of times. It is being taken up at all appropriate levels. They have advised that this will be considered appropriately, sympathetically, but they have not shared any categorical answer on that. So, but we will continue to engage with the US government on this issue to ensure that our people do not suffer, do not have any problem in that. Regarding passport extension, my colleague Vinayak had already answered that. And there was a query when India is going to open travel for the Indian citizens. So as of now, the ban on international flights operations is there till 14th of April. And as and when we have further instructions from Government of India regarding the same, we will be posting it. There was also a query regarding how do I find the contact numbers or the details of the consulate. So I will advise everybody to go through the embassy website as also the consulate websites. All details are there. The 24/7 helpline numbers, the telephone numbers, as also the emails are also mentioned there. There is also a chart which suggests that in which state you are and what consulate or embassy you should approach. So please go through, please be advised to go through that and accordingly make your queries. These are 24/7 helpline and we are trying to address all these concerns to the best of our abilities and we will continue to do so. Thank you.
Oh, thank you so much. Dr. Anupama garu, can you mention about the free clinics on the AAPI website?
Okay, so this last question is AAPI doing something like free checkup to Indian student or visitor who does not have insurance because the situation is due to Corona? So there are AAPI clinics, some cities have clinics, Indian physicians have clinics, and the information is on the website nafcclinics.org/find. So you can find, or if it is real emergency, you go to the any emergency, and they will help. AAPI, as such, doctors are already on the scene. Everybody is working, and there are no separate clinic like to say like go to this clinic, but you can log into nafcclinics.org/find. Thank you.
Any closing comments, Dr. Einstein, sir?
So main thing is like I want everybody to wash their hands when they go out of their home and wash their hands before eating and wash their hands frequently and take sleep, get enough sleep and stay healthy
and face mask when you go out.
Yeah.
Dr. Prasad, sir, closing statement.
Yeah, thank you again for the opportunity. For the audiences, I will say that focus on what you have control on. Don't focus on something that you don't have control on, because that is scary and that leads to anticipated anxiety that doesn't give you energy. So one other thing I will say is like plan for as if you get a problem, what is your plan? So the best time to have the map is before you get into the woods. So plan for it, but don't get lost in it in a way. So basically, what you will do inside the house if somebody gets it, or, just to get more educated about your symptoms and all that. But focus on what you have control on. This is a good time to practice your own health, exercise, good sleep, and improve your hygiene in general. Thank you.
Dr. Usha, madam.
Again, thank you so much for having me in this call. Like all my other colleagues said, there is a lot of information out there. I mean, a lot of messages we get through WhatsApp, the social media. So don't believe only the real data. Constantly watching the news because there is so much going on only will create anxiety for us. So we need to take this time out to spend time with our families and rejuvenate our bonds, and nature has its way of dealing with things at all the time. So we all need to be safe and just follow, only the recommended CDC or WHO guidelines, not just any news which comes our way. We just have to be careful.
Thank you, Dr. Shaman. Dr. Bharat sir, can you have closing statement? Okay. Dr. Sunil Singh, Harish, can you ask our leaders also?
Basically, most important thing, I've been getting messages, when is the next call? Can we have another call already? Can we do this again, Anuragji and Sureshji? Maybe in 4 days or so, because things are changing every day, right?
Sure. So we can plan on that. We can talk separately. Does anyone have, Dr. Sunil Singh, or Dr. Thelma, madam? Any closing statement from your side?
Okay, this is Sunil Singh. It was a very informative talk, and from embassy side, and all of you, all the doctors did give a lot of information. But as Harish said, it needs to be done frequently for next 2-3 weeks until it's over or it's getting better, start getting better. If you guys can arrange again next week, that will be great, at least once a week.
Sure. One more thing I want to add. I spoke to one of the doctors. I think he got a message in one of the hospitals in India. They are positive, some of them, but none of them in our hospitals, government hospitals, are in ICUs or ventilators. Or we are behind the cycle. Warm weather, we don't know. Maybe in a week from now, we know more. We may have some idea where we are. So. Please wear mask when you go out. Of course, anybody sick in the family, treat them like COVID positive, treat them. Otherwise, other people have high chance getting it. Wash hands like anything. And if anyone have any comments, otherwise, who is this? Suresh Reddy, you want to close the meeting? Are you there? Dr. Seema Arora, BOT Chair.
Yes. This is Dr. Arora, Chair of the National AAPI. On behalf of AAPI and all the attendees, I would like to thank the honorable guests from the Indian Embassy and all the people for taking their time out and coming and giving us all the useful information. And thanks to all the moderators, the patients, and all the organizers. So let's please continue this educational series of the conferences by AAPI. And as we said, next week we can have guests from Indian Embassy also for further updates. So with that, I would like to say to everyone that we will attend our next one. I think that's on Saturday. And please stay safe. Thank you all.
Thank you, Seema. Someone asking telemedicine or other help. You can ask local doctors, like everybody, like in myself, we're doing our telemedicine to all our patients. So everybody, AAPI itself asking question whether AAPI can do telemedicine, will send this information to EC and BOT and they will decide. But you don't need to wait for AAPI. Every doctor, almost everybody is saying telemedicine, so you should be able to reach locally at university, you should be able to find until we get some data from our side.
Actually, for telemedicine, we also prepared a lot of volunteers, medical students. Dr. Paul can explain in a minute.
Yeah, go ahead.
Dr. Paul, are you there? Okay.
Yes, I'm here. Thank you so much, Representative from AAPI and Lokesh, for including me during this conference. I've learned quite a bit. So from a leadership standpoint locally, our goal here is to provide access to care for our students locally and also our senior citizens as well. Obviously, like Lokesh mentioned, that there are countless amount of apps out there that patients can utilize to access care. What I've learned that's most important is whatever you use, from the phone to audiovisual to a formalized platform. Right now, it's information and awareness that saves lives. So our goal in the next few days to 2 weeks or so is to develop something that is very simple so that patients, senior citizens, and students can access just for information, and also to give them insight into physicians that are volunteering or are taking patients are dealing with this on a low or even moderate or severe level. I'm hopeful that I can work with the AAPI physicians as well to get these students and these individuals to the right individuals to provide care. So stay tuned, and we'll update AAPI on our organization and our data assessment as well.
Okay, excellent. Thank you so much, Dr. Paul. I really appreciate it. We'll present to the AAPI board. Dr. Suresh Reddy, AAPI Chairman, President, will close with closing statement, and then after that we'll call in. Dr. Suresh, go ahead.
Yeah, thank you, everybody. Thank you for organizing this. Special thanks to the Indian Embassy, Dr. Embassy Anurag Kumar ji, Thelma ji, Vinayak ji for participating, and also AIA, and all the moderators and the speakers. We have, please visit AAPI website, www.aapiusa.org. We have all the up-to-date information there, and we also have several help desks for doctors, non-doctors, physicians, students. So please join, ask for questions, any questions you have. And also, my personal note is, don't spend too much time on the TV or computer. Maybe 1 hour a day or 2 hours a day is good. Do some physical exercise. Catch up with your phone calls with your family. Use this time wisely. And I think mental sanity is also important during this time. Thank you all, and please visit AAPI website and to get all the up-to-date details. Thank you.
And also, all the information is individual given this, but this AAPI is not legally liable, or any speaker is not legally liable the information, because we're just sharing our thought process. But you have to go to the family doctor or your medical society or CDC for main guidelines. Thank you. And also the helpline also will going to get from AAPI. Thank you so much. Good night. Really appreciate all of you, speakers and embassies, faculty, and all the callers who joined us. Good night, sir. Good night, ma'am.
Good night, Dr. Thank you.
Thank you.
Thank you.